This study included 15,000 individuals from 3 different continents, and we basically put together data from different studies around the globe. And the study was designed to know the importance of how relevant it is to be overweight or obese, and also how relevant it is the distribution of fat. Every single patient had heart disease, and most of them had had a heart attack. Some of them had a bypass surgery. And what the study showed was that people who were with a special distribution of fat, and also with a particular combination of body weight and fat distribution, that we were able to separate those at a very high risk for dying in the long term compared to those with a very low risk, just on the basis of those two simple measurements. We found that individuals who were skinny according to body weight or according to the body mass index, but had a distribution of fat that was abnormal, meaning that the waist was larger than the hip, those individuals were about from 4 to 5 times more likely to die long term compared to individuals who were a little bit overweight, but the distribution of the fat was in the normal way, meaning that the waist was smaller than the hip. This study has some important messages and some implications for the general public. One is that this is the first time that we are able to divide people according to the risk for bad outcomes just on the basis of body weight and the distribution of fat. And also to recognize that a single measurement, meaning just weighing patients, is not enough to separate the risk in high, low, or very low. And we believe that these findings might change the way we assess obesity in the clinical practice when we see individuals with heart disease, because this basically departs from the common sense and the traditional way to just consider body mass index as the only important factor.